Hello, it's Dr. Rhonda Johnson. Today is Sunday, August 7th, 2022. Today I'm talking about COVID and pregnancy. Now, the evidence is evolving about the effects of SARS-CoV-2 infection on the health of the mother and as well as the health of the baby. But studies have shown that COVID infections during pregnancy do carry some risks. The risks are different depending on which trimester of pregnancy that you're in. But for example, COVID infections late in pregnancy can have a higher risk of preterm birth, increased rates of C-section, and increased complications in the postpartum period. In the large majority of COVID infections during pregnancy, babies are delivered uninfected. Now, today I'm going to be talking about a study which showed that the COVID virus can infect the placenta, and some placentas from infected mothers have evidence of severe inflammation. Now, remember that the placenta is the organ that develops in pregnancy. It provides oxygen and nutrients to the baby, and it also removes waste products from the baby's blood. But a recent article in the May 2022 issue of iScience, there were researchers at Weill Cornell Medical Center in New York, and they examined 52 placentas from mothers infected with COVID. And they found that in about half of the placentas showed evidence of increased inflammatory response and infiltration of maternal immune cells. Now, one of the senior authors of that paper said the main message from these findings is that placental infection can happen and can lead to severe inflammatory responses in the placenta, and that the short-term and long-term effects on newborns need to be monitored. Now, that study was done with the original virus and the Delta variant. They are currently studying placentas on women infected with the Omicron variants. And again, one of those scientists, the researchers, said that the evidence that they have gathered so far supports the idea that the newer variants are not only better at infecting moms, but also infecting the placenta. So my take-home message here is COVID is not over. If you are pregnant or know someone who is pregnant, please take steps to reduce your chance of getting COVID. I know it's hard. There's so much virus around, and the virus is so contagious. So you want to talk to your doctor about wearing a mask in public and use fresh air ventilation options whenever possible. Now, if you're pregnant and have COVID, please inform your doctor or nurse midwife as soon as possible. You may be a candidate for particular therapies. And again, evidence suggests that women infected with COVID may need close monitoring during pregnancy. That's my message. I'm not an obstetrician, so always discuss your health care concerns with your doctor or healthcare provider that's managing your pregnancy. Take care and be safe, folks.